I love it. Okay. Kids and overuse injuries. All right. Very good. So, just for the record here, my name is Sage, and I'm here with Dr. Dan Zanotti, specializes in sports medicine and arthroscopy. Is that how you say that? Arthroscopy?
Arthroscopy, but pretty close,
Oh,
Sage. Not bad.
arthroscopy. Okay.
Not bad.
Thank you. I'll try again next week. So, and what is arthroscopy?
So arthroscopy is where we use a small camera that we insert into a joint, whether it's a knee or a shoulder or a hip or an ankle. And then we can look around and see what injuries are there. We can fix things through the camera. So it's a general term that describes using a camera to make small incisions and look inside joints.
Interesting. So, is that a primary way you are working these days when you do surgeries and that sort of thing?
Yeah, more and more we do most everything through the camera, especially shoulder wise. We can do just about everything. Now, there are some things that we still have to open the joint up and do what's called an arthrotomy for a knee replacement or a shoulder replacement, for instance. That can't be done all the way through a camera, but a lot of things nowadays are done through these little microscopic incisions.
Wow. So when does it switch? When do you go from doing the microscopic stuff? Is it like when you're, you know, like doing, I would imagine, a knee replacement or
Yeah, so if we know we're going to do a replacement, we don't bother with the camera most of the time. We just open the joint up. But if we think we can repair things such as a rotator cuff tear or a cartilage tear, we certainly start with the camera and try to do the entire procedure through the camera.
Wow, 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 wow. Well, Dr. Zanotti, you will be pleased to know that we already have 3 people watching over on the Facebook page.
Awesome.
So,
hello out there.
I know, isn't that great? Especially considering I just, put it up to see if people would come. And so, anybody that is on the Facebook page, now is your chance to ask any questions that you want of Dr. Zanotti. If you know Dr. Zanotti, he's an awesome guy. Like, he's just so giving of his time. Didn't you say you do about you see 70 patients in a day?
Yeah, 60 to 80, something like that. So today's not too bad. I think I got about 70.
Wow. So the mere fact that you're here in that, it's just, thank you, man.
I got 20 minutes and we can go through whatever you guys want to talk about. Happy to talk.
All right, great. So I'll keep an eye on the comments. But a topic that you brought up was the idea of overuse, an overuse injury, and particularly with younger people, you're seeing a lot of.
Yeah, it's just something, Sage, I thought would be a good topic because we're in the midst of football season and soccer season and all the other sports as well. And we see these seasonally, but it's a pandemic in this country, no pun intended, with these overuse injuries in kids. Kids are just playing sports year round and having more and more repetitive injuries. And it's unfortunate. Most of the time we can fix them and get them back out there, but you never want to see a kid or even an adult get injured just because of overuse type things.
It seems like my kid's in high school and I've been going to some high school games, and it feels to me like kids these days are so competitive and play so hard. I don't know. Do you think that contributes to it? I mean, they go hard, it seems like.
They do. I think when we were kids, we went hard too. I think the difference is just the year-round access that they have. So soccer is a good example. Kids that play soccer in the fall for their teams in high school, that's just a small portion of their year. In fact, it's probably the lesser portion of the year. Their bigger portion is playing club soccer, and they play year-round. There's winter seasons and spring season and then summer season, all the while they're getting ready for their high school season. So there's never a downtime. And that's what's different, I think, than when we were younger. We would play a sport in the season and go on to the next sport, or we would go do something else. And these kids today don't do that. They just play consistently year round, whether it's baseball or soccer or the other sports.
If you had your way, would you like to see it done a little bit differently? Would you like to see these kids working out differently?
Yeah, absolutely. I mean, I try to, I try to really encourage my athletes and patients to really cross train and take some time away from their sport, especially after a season. So, my soccer kids, I try to get them to take a month or so, or 6 weeks or 2 months even off and do some conditioning, do something different. Because it's really been shown in a lot of studies, cross training in multiple sports to lower the rate of injury. I mean, that's the bottom line, is that It really prevents injury, and it actually has been shown in a lot of other European studies to actually increase their productiveness and their quality level in their major sport. If you look at tennis players, for instance, in Europe, they've done a bunch of studies that show that the tennis players who do multiple sports are much more successful on the international level than the ones who only play tennis. And it's an interesting finding. They've learned to cross-train their body to develop other muscles and other skills that eventually goes on to help them in their primary sport.
Is this counter to what the schools and I mean, are people that are doing the sports not in line with that idea that they want these kids to be playing year round?
Some of them, yeah, and I think what's really happened, unfortunately, is it's become a business. You look at AAU and other entities that for basketball and volleyball and all these things, they make money by having a spring season and a summer season and a winter season. And a lot of these groups, I mean, that's their primary income is they're there to sell their program to kids, and they kind of trick them into saying, if you don't do this, you're going to fall behind. But in actuality, the science is different. The science says that you're better off cross training. You're going to become a better overall athlete. You're going to have better success at the next level. So part of it, I think, is this business push that we see from these entities that are really trying to get kids to pay money to play in these other groups.
Yeah. So cross training, you don't have to stop playing a sport. You recommend just play something else.
Absolutely. Yeah. I mean, obviously you need a little rest after a long season, but certainly, whether it's getting in the water and swimming, weightlifting, different muscles is the key. So you don't have to stop completely. You just have to change it up a little bit to give your body a break.
All right. Well, we've got a nice group of people over here on Facebook. We're with Dr. Dan Zanotti. If you have a question for Dr. Dan, feel free to put it in the comments and I'll relay it to him. So what are the hot sports right now? Are we in soccer season?
Full bore soccer. We got football going on. We got some volleyball. And then again, there's the year round sports, a lot of the fall baseball season. Baseball is probably one of the bigger culprits in this whole overuse thing. We see tons of kids and adolescents with little league elbow or shoulder injuries from repetitive throwing. So we see that in the fall as well. So it's everything. Everything's going on. And, in the midst of fall sports, we're seeing lots of ACL injuries as usual, unfortunately, and those sort of things. But trying to keep it down to a minimum and keep these kids healthy.
Wow. So that is surprising to me. The little league elbow, like of all the sports, I would have not guessed that it was baseball that is a big culprit, but it is, huh?
Yeah, baseball is one of the biggest, and it makes sense from an anatomic standpoint because the elbow and shoulder are two of the slower growing joints in your body. The growth plates where the bone grows stay open for a long time, and those are weak spots in the bone. So when you have repetitive throwing, it stresses those growth plates. You can actually get growth plate separation, occasionally requiring surgery. But we see that in baseball just because of the torque that these kids put on their arm, whether it's shoulder or elbow from repetitive pitching and throwing.
Yeah. Dr. Dan, do you see the image I just put on the screen?
I do.
Yeah. So this is, I just did a search for Little League elbow and this came up. Can you describe a little bit what we're looking at here?
Yeah, it's hard to see because the font is small, but if you look at the picture, it has a picture of an elbow and then a red area where it says growth plate. And that's exactly what I was talking about. The muscles, the red muscles going down the arm attached to that growth plate. So when you throw or use your arm extensively, it pulls on the growth plate and can cause pain. And that's exactly what Little League elbow is. It's inflammation of that growth plate.
And what's the treatment?
Well, the first thing you have to do is stop throwing. And that's harder than you would think sometimes. Especially if you have parents who are, really trying to get their kids to a higher level, they think that they have to play year round, and that if they miss a season or miss a scouting event or something like that, their kids are going to fall out of favor. So you have to shut down the throwing, number one, and then you have to rehab the arm to get the elbow or shoulder back in shape so that they can throw again without causing the same problem. And that takes several months. That's hard for players and it's hard for parents to understand, but that's really the needed treatment.
And so you see this enough that you would like to probably suggest that if they would cross train and not get to that point, they would probably be able to actually play more. Is that possible?
Absolutely. Yeah. And that's part of the conversation that we have. Obviously you want to treat the athlete as best you can and get them better, but you also have to have a long-term plan, which involves cross training, taking time off, doing something to let their body recover and then prepare for the next season rather than playing month after month after month. So that's part of the long conversation.
So it's almost like you need a consultant. Like I would imagine, I mean, you're going to your coaches. Like, so if if you've got a football coach or a baseball coach, are they talking a lot about this, or are they just focused on their sport?
It's across the board, Sage. You have some coaches who are really willing to buy in and encourage it. I can think of a couple soccer coaches along my experience who were totally into cross training the kids and getting them away from the sport for a little bit, and were willing to really read the studies and understand it, and it was fantastic. On the other hand, I have coaches who are just completely single-minded that their sport is all that matters, and in some ways it does to them because maybe their livelihood depends on it. And they push these kids to play year round. And that's unfortunate. That takes a lot of rerouting and training of mindsets. That's the hard part.
Are there coaches that simply don't know that this is an issue?
Yeah, absolutely. Where I think we're doing a better job getting the message out there, certainly compared to 10 or 15 years ago, it's much more well known. And again, most coaches who really care about the athletes and care about the kids are more than willing to learn and to understand the process. But we do run into the occasional ones that don't. And honestly, it's actually more the athlete and parents probably than anything. The athlete is so driven, they want to be out there and they think they're going to fall behind. And the parents see this as a chance to maybe get a scholarship or move on and really push the kid beyond what they're capable of doing. That's where the real education comes in.
It's interesting as I listen to you, it seems like a lot of this comes down to dollars and cents. Like, some of the coaches are driven because that's what they need to push, and some of the students are driven because they want scholarships. And I mean, is that the reality?
It's true. I mean, that's unfortunately that's the world we live in. A lot of these kids don't get to play sports just for the fun of it, which is really the true benefit, being on a team. Working hard toward a goal, obviously the athletic part, being in shape, all those are really your main goals. And unfortunately it gets pushed to the side for these other endeavors. And that's just the reality of where we are in this day and age.
Yeah. Do a lot of people get sports scholarships, or is that, I don't know anything about, are you aware? I mean, is it worth pushing that much?
It's about 1%, sometimes 1.5% of high school athletes will get a scholarship. So 1 out of 100. Think about that in terms of your football team or your basketball team. It's not many. And then of those 1 of 100, 1 in 100 in college may go on to play professionally. So, if you do the math, it's extremely rare to be able to earn a living playing a sport is the bottom line. Not that it can't happen, and not that it's not a goal. I certainly encourage kids, if they have that goal, to pursue it. But if you're going to do it, you want to do it in a way, just like you want to lift as much weight as you can. You want to prepare yourself in a way that gives you that best opportunity. And that's not by playing year round. It's actually by doing other things and training your body in different ways.
The message as a musician that I want to spread to the world is play viola. Everybody needs violas, man. That's where you get the scholarships.
You're right. Absolutely. There's lots of scholarships out there. You just got to pick the right sport. I agree.
Speaking of music, do you run into musicians in your work?
We do. Yeah. I mean, especially I do a lot of upper extremity, arm and hand things. So a lot of guitar players, they get tendonitis issues, and then obviously trauma injuries can be really devastating to those people. So yeah, we have a fair number of musicians that we see.
Is that a carpal tunnel issue?
It can be. A lot of times though, they see it as they get a bit older. They get some arthritis from years and years of playing, and some of that arthritis is genetic anyhow. So we see it in people who are trying to maintain that youth and play 5 or 6 days a week, and maybe their bodies just don't like that anymore.
Oh, interesting. So they too can't play as long and as hard. when they get older.
It's true. Your body has a limit, whether it's, being a construction worker, you can't do that forever. You can't, play guitar 7 days a week, 4 hours a day forever either. So it's absolutely the same.
Speaking of like these, these young people that are playing these sports and getting these injuries, does that have ramifications when they get older? Does that creep up on them?
Oh, it can, certainly. I mean, if you take ACL injuries, knee injuries, and ligament injuries, for instance, we know that those patients have a much higher risk of developing arthritis as they get older. So even if, it's a young, healthy patient and we fix their ACL, they still have that elevated risk down the road to develop more problems. So yeah, these injuries can have lifelong implications. Yep.
Wow. Yeah. Well, we have a nice group of people, but they're kind of quiet. So, but
come on, guys, now's your chance. Ask some questions out there.
I know. I mean, it's so great. Have you seen anything surprising this week in the news or at the center?
We always have surprising things. Lots of falls. I think people are trying to cram in all of their end of summer activities into the last few weeks. So lots of broken bones and lots of people trying to be active, but unfortunately having some injuries. But that's okay. That's why we're here, and we'll fix them up.
That's awesome. Falls around the house. You see that a lot?
We do, especially in older patients. Falls are terrible. It's one of the things that we really try to preach to our older patients is that you need to maintain balance. You need to maintain a level of fitness, because as you get older and as you have these falls, it can really cause serious injury, whether it's broken shoulders, broken vertebrae, even broken hips. Those are life-changing events. So we really have encouraged people to try to maintain balance and activities that'll promote fitness.
Can you just rattle off some good exercises for elderly people?
Yoga, great exercise.
Oh.
I'm terrible at it personally. I do it because I think it's really beneficial in terms of flexibility and strength and balance. So it has a lot of the great components that you want. And it doesn't mean you have to do it 7 days a week again, but incorporating a little bit of that into your weekly regimen is really, really helpful. So definitely a great one to start if you haven't done it.
Yeah. Do you work in scoliosis? Is that?
I don't do scoliosis surgery, but I certainly see patients that have scoliosis.
There was this thing that was trending on Reddit, and I was wondering if I can show you this video.
Absolutely.
So here, hold on one second. Let me figure out how so you can see it.
Scoliosis is extremely common, by the way, and it rarely requires surgical intervention. In a lot of places, we call it scoliosis because people will get a physical for their yearly school intake, and they'll see a little bit of curve and they think they have bad scoliosis.
Yeah.
But it's really rarely anything terrible.
Yeah. So this is apparently halo gravity traction. Can you see this video?
I can, yes.
So this was shocking to all of us on Reddit, but other than this kid just being a kid, I guess this, they said that him doing this move was not typically part of the therapy. He's just having fun. But this is apparently halo gravity traction is a thing. Is that right?
Yeah. Now, I'm not sure what condition they're treating there. If he actually has pins entering the skull, sometimes when you've got neck and spine disorders, you have to wear this halo device.
Yeah.
And I'm not sure if that's what his diagnosis is.
That's what they said on Reddit. I don't know.
But he's certainly having fun. Hey, why not? If you're going to have to wear a halo, you might as well have some fun with it.
Yeah. So that is would you say that's a common approach to helping kids, like using this halo traction?
That's not very common.
Oh, okay.
that's probably why it's so interesting to see. You don't see that very much.
Sorry.
No, it's okay. It's one of the therapies for sure.
Yeah.
It's not very common. And again, most people don't need that. Scoliosis requiring anything significant is pretty rare. Not that it can't happen, but it's much less than you would think.
Yeah. Yeah. How do you know if you have scoliosis? Like, they do these checks still in school?
They do, and that's why we call it scoliosis, because it's really from the school nurse. And again, most of these little curves in the spine are very mild, and people grow out of them as they get older. But there are occasions where the curve in the spine is significant, and then x-rays would show you that. You can actually measure the curve, and when it gets to a certain angle, some treatments are needed.
Fascinating. Well, Dr. Dan, thank you, man. Thank you for
Oh,
being here.
Happy to help. My pleasure.
Well, yeah, people are definitely here, and so I hope we can continue to do this because I find it amazingly fascinating.
Yeah, very fun. I appreciate it, Sage.
I appreciate you. All right, Dr. Dan, have a great day, and we will see you the next time.
Enjoy your day. Thanks,
Okay,
everybody.
bye.